We're going to talk about the examination of the nose. Important external topography. Bridge of the nose is made up of the nasal bones in the top third. This is then attached to the upper lateral cartilages of the nose, which forms the bridge. And the tip of the nose is formed by the lower lateral cartilages of the nose. When a nasal fracture occurs, it usually occurs at the inferior portion of the nasal bone, which is the thinnest, resulting to the deviation of the nose. It is important when there is a nasal fracture to check inside the nose for a septal hematoma. The light source is brought in, and when we bring the light source in examining the nasal septum, check the area anteriorly for any sites of bleeding. We also check for any nasal septal deviation, or if there was a nasal fracture, look for a septal hematoma. We can then look at the inferior turbinate, checking for things such as allergic rhinitis, and then we could look superiorly, look at the middle turbinate and the space below the middle turbinate, referred to as the middle meatus. Otoscope and endoscopy. Alternatively, one can use either an otoscope or an endoscope to check the nose if available. When using an otoscope with a large nasal speculum, one can have a better view of the posterior aspect of the nose. To check for a patient's nose and throat using an endoscope, anesthetize the nose of the patient first by either using a spray or a nose cotton pack with anesthetic on it. Allow adequate time for the anesthetic to work before proceeding. Always inform the patient when you're starting, and ask them that when they start to feel a pinch or are uncomfortable, they should let you know. The scope is placed into the nasal vestibule, and starting along the floor of the nose, one sees the entire length of the nasal septum and inferior turbinate, including the middle meatus. Occasionally, one may see the superior turbinate in the endoscopy. If you continue posteriorly into the floor of the nose, the opening of the eustachian tube is seen laterally. This area is known as the fossa of Rosenmuller. In the examination of the nose, note any deformities or asymmetry of the nose. Upon inspection of the nasal passage, note the color of the mucosa as well as the presence of any bleeding, discharge, or swelling of the mucosa.
A way to examine the internal anatomy of the nose is using nasal speculum. A nasal speculum is held by placing your index finger to the tip of the nasal speculum, asking your patient to extend the neck in order to have a better vision of the internal parts of the nose. A source of light is needed in this procedure. In this case, we will use a drop light. Scope, flashlight, open light are also appropriate or alternative devices. And then, we will insert the nasal speculum into the nasal vestibule. What is important here is that the nasal speculum should rest against the alar of the nose, not the septum, because it can cause pain. When the speculum is inserted and resting against the alar, pushing it out slightly outward, it can be opened slowly without causing the patient any discomfort. When we're done examining the nasal cavity, it is important not to close the speculum inside the nose, as the nasal hairs can be grasped between the mouth of the speculum, which can cause pain to the patient. When removing the speculum, pull slightly, not all the way, and then remove it. We will now look at the patient's other side, and the procedure is repeated.